Simply Women's Health with CJ. Today we're going to talk about preterm labor. Preterm labor is any labor that occurs before 37 weeks gestation. If you are beyond 37 weeks, you are now term, and preterm labor precautions no longer apply. So who is at risk for preterm labor? People who have had a premature baby in the past. If you have ever had any kind of surgery on your cervix, such as a leap for cervical cancer. If you are carrying more than one baby, you're at increased risk for preterm labor. If you are a person who has not had good prenatal care, if you've only had a couple of visits, statistically you're at greater risk for preterm labor. If you have if you're a person who uses tobacco, alcohol, illicit drugs, if you have any kind of an infection, whether it's chlamydia, gonorrhea, if you have bacterial vaginitis, if you have a urinary tract infection, all of those things can also lead to preterm labor. So what are the symptoms? How would you know you might be in preterm labor? Contractions. Now, cramping is very common, especially as your pregnancy moves along, and it's normal for you to have cramps, twinges, round ligament pain. If you are having 5 or more cramps in 1 hour, if you have water running down your leg and you know that you are not peeing yourself, if you are bleeding like you're on your menstrual cycle. Now, if you have intercourse and you have some spotting afterwards, that's not anything to be too terribly concerned about. But if you're bleeding heavy enough to saturate a pad, that is more worrisome. If your baby isn't moving like he or she normally does. If you are having pelvic pressure. Now, pelvic pressure is very normal. But if you are having pressure in your pelvis that doesn't resolve when you rest, it just either stays the same or gets worse, again, you might want to contact your provider. So if you do go to your birthing facility and you are concerned about preterm labor, a few things are going to happen. First of all, they're going to ask you when was the last time you had intercourse. Again, when you have sex, semen contains a hormone called prostaglandin. Prostaglandin can actually bring on contractions. So that's actually a legitimate question. They're probably going to put you on the monitor and see if you're having any contractions. They're going to want to do a urine culture. Again, urinary tract infections can cause preterm labor. They're going to want to do some swabs, rule out infection. They may also do what's called a fetal fibronectin. That is a swab that detects a protein that your body gives off when it's preparing to go into labor. Some things that they might do if you are having contractions or there's a concern for preterm labor, they'll probably want to start an IV and give you IV fluids. The uterus is a muscle. Muscles respond to dehydration by cramping. So IV fluids are almost guaranteed. They may want to give you some medications. There are some medications they can give you that will calm your uterus down. There's also medications that they may think about giving that can rapidly mature the baby's lungs. That's going to be very dependent on how far along you are and what your provider preference is. If you are very early and you are in a facility that cannot manage a preterm baby, they may look at transferring you to a more high-risk facility, one that has a neonatal intensive care unit. Bottom line, if you are concerned that you might be experiencing preterm labor, please contact your OB provider. Hi, if you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement for a visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.